Have you ever got to the comment section of an intern evaluation and wondered how to say what needs to be said? Your comments are an essential part of your evaluation in providing evidence for your ranking, for telling the university about the intern's performance, and for giving examples for the intern to reflect on in their final summary of internship. Let's talk about how to write high-quality comments. High-quality comments are specific and based on observations. Comments that are critical in nature should get to the root of what needs to change and why. Some questions you can ask yourself when writing comments are: what actions did I observe that made me pick this rating for this transferable skill? How does the intern's behavior compare to the standard, the KPI? What specific actions did the intern do well? What is it about the way these actions were performed that I thought was well done? What is it about the way these actions were performed that I thought was not good enough? What specific actions does the intern need to work on? Why does the intern need to put in more work for this transferable skill? What will more work or more practice achieve? Let's look at some examples where we can write some excellent comments. Let's start with a comment about one of the professional practice competencies, as these are evaluated by every preceptor in every rotation. We'll use P8, manages time and workload effectively for the area and place in the internship, adapts to changes in the practice setting. For this example, we will pretend that we had an intern who had difficulty managing their time, and we are ranking them at an advanced beginner level. Let's ask ourselves, what is it about the way these actions were performed that I thought was not good enough? The comment might be, the intern was challenged by the amount of work that could be completed in a day. Early in the placement, they had to stay late most days in order to finish their work. In this last week, they stayed late on 2 of the 5 days. The intern's time management and efficiency has improved from novice to advanced beginner, but the intern needs to continue to work on time management so that they can consistently complete their work in the allotted time. This is a strong comment because it focuses on the intern's action of staying late. It quantifies in relation to the KPIs, which state that at an advanced beginner level, the intern is generally able to estimate the volume of work that can be completed in a allotted time period. Whereas at a competent level, the intern is consistently able to estimate the time required to complete workload volume. It is specific about which behavior was evaluated and the level of consistency of performing that behavior the intern achieved by the end of their placement. It gives the intern something concrete to work on, ensuring that their work is done in the allotted time. Let's use this same skill of P8, manages time and workload effectively, but this time let's write a comment for an intern that has a competent ranking in this skill. The comment might be, the intern was able to manage their time and determine how much work could be done in a single day. In this final week, the intern was able to determine how many patients they could see in a day and discussed with me on how we could best split up the workload. The intern was able to see all patients assigned to them and complete documentation before the end of the day. This is a good comment because it is specific about how the skill was exhibited to the preceptor. It shows what the preceptor observed in the intern's behavior. It also relates to the KPIs in that P8 at a competent level states that the intern is able to develop work plans, set personal deadlines, and employ time management strategies. The preceptor's comment demonstrates that the intern made a work plan with their preceptor to allow for adequate time for all patients to be seen. Let's look at another example. This time, let's look at the clinical competencies. We'll use C4, interprets nutritionally relevant lab data, medical tests, procedures, medications, and supplements. Let's do an example for a comment at an advanced beginner level. The comment might be something like this. Throughout this placement, the intern was able to identify relevant medications and their purpose, but had difficulty linking medications to the overall clinical picture. For example, For a patient with diabetic ketoacidosis, the intern was able to identify the need and purpose for the patient getting insulin, but was unable to explain why the patient was also being given potassium. The intern was unable to explain the relationship between the two medications and the patient's condition, despite us having discussed refeeding syndrome for a different patient earlier in this placement. The intern would benefit from asking themselves how the patient's medical condition is related to the medications they are receiving. This is a strong comment because it describes the component of this transferable skill that was lacking. The KPIs for this skill say that at an advanced beginner level, the intern is beginning to determine the relevance of the information obtained. At a competent level, they are able to put relevant medications into the overall picture of the client's needs and draw relevant conclusions. This indirect comparison to the KPIs helps justify the given score. Including the observed behavior is also important, as this example fully illustrates where the intern had difficulty. It is also important that the comment mentions that the intern should have been able to identify this, having seen something similar in this placement. No one can be expected to know every medication and what it does, but this topic had been discussed with the intern, and it wasn't that the intern didn't know what the medications were, it's that they weren't linking it to the physiology of the patient in that condition. Lastly, this comment is strong because it gives the intern something to work on. The intern can create a goal about linking the medical condition to the medication rather than just knowing what a medication does. Let's wrap up this video by writing a comment for an intern who is competent at C4, interprets nutritionally relevant labs, meds, procedures, etc. Let's try something like this. The intern did an excellent job at demonstrating critical thinking when considering the serum sodium levels in relation to the fluid provision, recognizing the relevance of the IV fluids. This comment is brief, but it is specific to sodium and fluid, and it still references the KPIs, because at a competent level, the intern uses critical thinking to determine how to obtain all nutritionally relevant labs, meds, etc. When writing comments, pick an example that best illustrates the skill you've selected, or something that the intern did particularly well. It would be impossible to describe every time the intern reviewed medications, labs, or procedures and explain how they demonstrated the skill for every patient, so just pick 1 or 2 examples. Lastly, you don't need to write a comment for every skill. Comments are requested for any and all skills ranked novice or advanced beginner, and any skills you wish to highlight. In summary, the best comments you can write are specific, based on your observations of the intern, relate to the KPIs, and make a suggestion on what needs to improve. Comments should be written for any and all skills ranked novice or advanced beginner to explain your ranking and to help the intern form a goal for improvement. You should also write comments for any competent skills you wish to highlight. Thanks for watching this Preceptor Skill Snack.